Good evening, I'm Ian Hanamansi. Tonight, another meat plant shutting down because of COVID-19.
It's either reduce the production or we'll have people working side by side.
Where it leaves Canada's food supply. COVID in the White House. The Vice President in isolation.
It is scary to go to work.
The Trump administration scrambles to contain cases in its own ranks. A mysterious, rare, new inflammatory syndrome appearing in children.
This is every mother's nightmare. This is every parent's nightmare.
Is it linked to COVID? We hear from one of the key researchers. Celebrating together, apart.
I said, I love you, Mom, and I miss you.
The creative ways Canadians are saying Happy Mother's Day. This is The National. A major meat processing plant in Quebec is in the process of shutting down because of a COVID-19 outbreak among workers who do their jobs in very close quarters. This crisis is laying bare who we count on to keep our fridges stocked. The country's biggest outbreak so far has been at an Alberta plant owned by the same company, Cargill, Canada. Jayla Bernstein shows us that when it comes to putting meat on your plate, there's no such thing as zero risk.
Soon, this parking lot will be empty. Already, more than 30% of the workers have been sent home.
The zero risk doesn't exist anywhere.
Since public health officials intervened 2 weeks ago, the company introduced staggered break times and installed plastic barriers where workers had to be working close to one another. This union spokesperson doesn't blame the company.
They cannot do anything to, it's either reduce the production or we'll have people working side by side. So, but with the plexiglass, with the visor, the mask, and the glasses, well, that helps, you know.
The outbreak is not as severe as the one that tore through the company's Alberta plant. This time, Cargill is shutting down operations before it gets that bad. A spokesperson said in a statement, "As standards evolve in the fight against the virus, we are continually learning and improving how we respond to protect our employees and keep the food system operating."
If I were a virus, I would love meatpacking plants. It's plus 4 degrees. It's very humid. It's a very humid environment. People tend to work close to each other as well.
The meat industry was already in need of an overhaul before the pandemic, this food supply chain expert says.
Our plants here are old, one, and secondly, plant design doesn't really accommodate for management to make sure that employees are secure and protected. That's the reality of our system in Canada.
While plant closures aren't likely to cause food shortages, people should be ready to pay more for their steaks and chops. Cargill says it will reopen its plant here as soon as possible, but that employees, of course, will have to be free of any symptoms before they can return to work. So far, 3 sick workers have recovered. Jayla Bernstein, CBC News, Chambly, Quebec.
And here's another sign that Canada's meat processing plants are a COVID-19 hotspot. In Brooks, Alberta, 7% of the population has tested positive. That's more than 1,000 cases. Many are linked to a plant owned by JBS Foods, where as many as 600 workers may have had the virus. On Tuesday, a second pop-up facility for testing will open in Brooks. And just like Canada, the biggest U.S. outbreak of COVID-19 was in a meat processing plant. After closing for 2 weeks, this facility in South Dakota had a partial reopening on Thursday. The president has made it clear supply is a top priority. Still, plants in at least 19 states have suffered outbreaks. Even the White House isn't immune to coronavirus. Tonight, it announced that Vice President Mike Pence is the latest to self-isolate after one of his aides tested positive. Paul Hunter has that story.
He has repeatedly tested negative for the coronavirus, but tonight the U.S. Vice President is self-isolating on the advice of White House medical experts. Mike Pence is expected at the White House tomorrow, but will limit his contact with other people. All of it just days after Katie Miller, Pence's press secretary, tested positive for the coronavirus, underlining it's made it into the White House grounds. Indeed, 3 senior White House advisors on coronavirus, among them key scientist Dr. Anthony Fauci, will this week work from home, self-quarantining after word they'd also been in contact with someone at the White House who's tested positive.
It is scary to go to work.
Kevin Hassett, a senior advisor to Donald Trump, today underlined that as America reopens, it's the kind of circumstance the country will have to deal with.
This is a very, very scary virus, that people are going to go back to work and they're going to be worried about things.
Indeed, the Trump administration continues to promote the reopening of the U.S. economy broadly. But tonight, Trump himself is reportedly annoyed that word of the virus now within the White House will hurt his messaging on the economy. Meanwhile, Trump's general approach to the pandemic came under fire this weekend from his predecessor, with leaked audio of Barack Obama in a group phone call criticizing Trump's response as, quote, anemic and spotty.
It has been an absolute chaotic disaster.
Trump replied to that, as he does, in a tweet, slamming Obama and Joe Biden for their response to the swine flu pandemic a decade ago. Poor marks. Didn't have a clue, wrote Trump. The White House calls Trump's response to the COVID crisis unprecedented. Paul Hunter, CBC News, Washington.
In New York, health officials are investigating up to 85 cases of a mysterious new illness in children that may be related to COVID-19. 3 children died over the past few days, and as Briar Stewart explains, it's prompting doctors on both sides of the border to take a closer look.
In a state at the epicenter of the COVID-19 crisis, New York is seeing a disturbing rise in something else. Children with a mysterious inflammatory syndrome that could be triggered by COVID-19.
This is every mother's nightmare. This is every parent's nightmare.
3 children have died and dozens of cases are under investigation in New York State alone. The symptoms are similar to those associated with Kawasaki syndrome, a rare illness that affects young children.
Because it's affecting the heart and it's inflaming the blood vessels, red is sort of the key symptom. The rash and then the red palms, soles of feet.
At this Montreal hospital, doctors have seen between 15 to 20 cases and suspect the patients may have been infected with COVID-19 earlier.
A significant red flag.
Dr. Stephen Friedman is leading an international study tracking approximately 1,500 children who've been tested for COVID-19 in 14 different countries. He says apart from the hospital in Quebec, there doesn't appear to be a significant number of cases in Canada, but there have been more reports in Europe.
It seems that it is a delayed phenomenon in most countries about a month after the peak of prevalence of COVID-19 in a region.
He says unlike Kawasaki syndrome, which usually affects toddlers and young children, those turning up in hospitals with these inflammatory symptoms are older, closer to their teens. Friedman says some of the data from the UK shows that in the majority of those cases, the children have tested positive for COVID-19. But he says all of this needs to be put in perspective.
It's still a very small number of children. Thankfully, way fewer than we're seeing severely affected on the adult side.
Still, he says it highlights the importance of more research to understand just how COVID-19 can affect children. Briar Stewart, CBC News, Vancouver.
Well, to get some more on this, let's bring in Dr. Srinivas Murthy in Vancouver, an infectious disease specialist and a doctor at Children's Hospital. I guess, first of all, what's your message here for parents?
First of all, it's a very rare condition right now, and we're still learning about it, but there's only been a handful of cases across Canada and across North America. So I wouldn't worry that every small fever and every small rash on your child is this. Obviously, if your child looks sick and if there's concerning signs, to seek out care. Every hospital in Canada and every pediatrician in the country has been notified and is well aware of this condition and will react accordingly.
From your perspective as someone who studies infectious diseases, among other things, what does all of this tell you about COVID-19?
If we can prove that it's related to COVID-19, we haven't proven that yet. And there's lots of science going on right now with all of these children to try and make that link. It's a hard link to make scientifically, to be honest. But if we can make that, it tells us that COVID-19 affects children and adults in very different ways. And the reasons for that are very important for us to find out as we learn more about how to develop a vaccine or how to manage it across populations. It tells us that it probably has effects on the immune systems as well, and may have specific effects on a developing immune system in children.
Yeah, sure is interesting to me after all these months how much we still don't know about this. Dr. Murthy, thank you very much.
Have a good day, Ian.
Here's the situation with new COVID-19 cases across this country tonight. Just 7 newly confirmed infections in Nova Scotia. Alberta reporting 96. Saskatchewan 11 and 3 in Manitoba. Another big number in Quebec, though, with 735. And what appears to be a sign of progress in Ontario, 294 today. That's the lowest daily count since March 31st. Overall, Canada has been flattening the curve, in part, as you know, by having fewer people travel to work and school. That has hit transit systems hard, and some cities are cutting service. As Natalie Collada shows us, that has some transit users feeling more at risk.
It's hard when you know you have to get to work, but getting to work is the most stressful part of your day.
Sarah Strum is an essential worker whose daily commute on public transit makes her anxious.
We're all sitting there and we're able to socially distance, but then more people get on and then you kind of see everyone like looking at each other being like, okay, what do we do now?
Experts say public transit usage across Canada has dropped from nearly 5 million a day before the pandemic to just 1 million a day. That means Montreal's Regional Transportation Authority expects to lose up to $244 million this year. TransLink in Vancouver is losing an estimated $75 million every month. And in Toronto, the TTC is estimated to lose $90 million a month. So starting today, the TTC is cutting service by 15%.
It's pretty stressful.
This is Recha Brown's bus ride to work today, during off-peak hours and on a weekend. Now imagine weekday rush hour with more people aboard.
You're risking, okay, should I be safe or should I be late for work?
It's a question the Canadian Urban Transit Association says no commuter should face.
How can we open our federal economy while transit across the country is closing? It just doesn't make sense. We're not going to see that V-shaped type of recovery that was promised by many economists.
Layoffs and service cuts in Vancouver were averted this week after talks with the province, while Prime Minister Justin Trudeau and Ontario Premier Doug Ford offered no firm promises.
We have everything on the table right now.
The federal government is always looking to be a partner in helping out in terms of economic relaunch wherever we can.
So for now, most transit users wait and worry. Natalie Collada, CBC News, Toronto.
At least 10 taxi and limo drivers at Canada's biggest airport have died since the pandemic was declared. And while the risk may be lower now with so few air travelers these days, as Ellen Morrow found, the fear of doing the job is still high.
At Pearson International, extreme times call for extreme measures. Drivers doing everything they can to stay safe.
You must use the face mask when picking up the customers from the terminals.
Still, with safety warnings ringing out, anxiety is rife.
It's not enough safety. You have to deal with the customers. You know, you get worried about where they're coming from, if they have the disease or not.
Worry compounded by grief. Karam Singh Punia is one of at least 10 airport drivers who've died during the pandemic. 6 had tested positive for COVID-19. Punia was a well-known advocate for drivers.
Everybody's sad. This is the sad news in the community, and everybody's shocked that he's not anymore here with us.
In March, as a deluge of Canadians returned, airport drivers were on the front lines, ferrying travelers from around the world home to begin their self-isolation. Little time for drivers to prepare for their new reality.
People needed to get home from the airport, and those drivers stepped up and took care of them. That's when most of the danger happened.
Drivers now have better protection. The Greater Toronto Airports Authority helping them disinfect their vehicles between trips. But some drivers say they were forgotten by the airport and the government, even as they played an essential role.
When all these Canadians were coming back, at that time they didn't provide us any protection. There was not much warning either.
The risk for drivers today is lower, with travel at a near standstill. But that brings another crisis, the struggle to make ends meet. Ellen Morrow, CBC News, Toronto.
Airlines are also struggling. After losing $1 billion, Air Canada wants to get people back in the air and will soon use a controversial COVID-19 screening measure. Ashley Burke examines the privacy concerns that come with it.
Michael Gerzik is a paramedic who works for long stretches in Nunavut and commutes home to Montreal on Air Canada. But starting Friday, he, along with all other Air Canada passengers, will have to undergo a mandatory temperature check.
It may make you feel comfortable, but not really capturing people that are actually experiencing symptoms coming through.
Hard-hit Air Canada is going to great lengths to get people back on planes. It's following the lead of other countries and will become the first in North America to make temperature testing mandatory.
I think that it's better to be prudent, to do what you can, to know that it may not be a perfect system. It's not going to detect everything, but it is a method that can be used.
I think it's going to be a breach of privacy law.
This human rights lawyer says companies can only collect sensitive personal health data when it's absolutely necessary.
When people are in a line and Air Canada's doing these temperature checks, it's stigmatizing. Everyone's going to see you being turned away. People will, ask, well, what happened to that person? Or maybe that person has the disease, when in fact they may not.
Transport Canada doesn't require the tests. Canada's top doctor warns against it.
The more you actually understand this virus, the more you begin to know that temperature taking is not effective at all.
It's just nonsense that you wouldn't pay attention to Dr. Tam on this, who has indicated there's no value in obtaining body temperatures.
There are also concerns about where this personal data could end up.
You don't know what they're going to do with that information. Will it be in their data banks? Will it be shared with others? Will it come up the next time someone flies?
Air Canada insists it's required by law to evaluate passengers' health during the crisis and says this is an additional layer of screening that will make flying safer. Ashley Burke, CBC News, Ottawa.
Britain has been hit hard by COVID-19. With nearly 32,000 deaths, it is second only to the United States. But tonight, Prime Minister Boris Johnson announced the first small steps to ease his country's lockdown. Renee Filipponi has the details.
The British people have been waiting 7 weeks for this and tuned in to hear the Prime Minister's message, stay at home, shift to stay alert.
We have a route and we have a plan. And everyone in government has the all-consuming pressure and challenge to save lives, restore livelihoods, and gradually restore the freedoms that we need.
Everyone who can is now being encouraged to immediately return to work and, if able, walk or bike instead of using public transit. Starting Wednesday, unlimited outdoor activity will be allowed, but social distancing rules will apply. Some children will go back to school and shops partially reopen in June, with more things set to return later in the summer. But it's conditional on the infection rate staying low.
If there are outbreaks, if there are problems, we will not hesitate to put on the brakes. We've been through the initial peak, but it's coming down the mountain that is often more dangerous.
The UK has been hit hard by COVID-19. The government has been criticized for not acting fast enough. Now some worry it's acting too quickly.
The Prime Minister appears to be effectively telling millions of people to go back to work tomorrow, but we haven't got the guidelines and we don't know how it's going to work with public transport.
In a tweet, the London Chamber of Commerce is telling people not to change their plans just yet, to stay at home and wait for more detail. Some political leaders are urging people not to listen to the Prime Minister.
The message in Scotland at this stage is not stay at home if you can. The message is, except for the essential reasons you know about, stay at home, full stop.
With this announcement, these empty streets and parks will get busier. But today is just the first step out of lockdown. More details will be unveiled tomorrow. Renee Filipponi, CBC News, Vancouver.
And turning to other news, we have an update on the Canadian military helicopter crash a week and a half ago. Ontario coroners have identified Captain Brendan Ian MacDonald through DNA testing. Originally from New Glasgow, Nova Scotia, MacDonald was one of 6 military members killed when the Cyclone helicopter went down off the coast of Greece. 4 others remain missing and presumed dead. It's considered one of the best weapons in the fight against COVID-19. Next on The National, we get a first-hand look at testing in Canada.
We as a society are failing older people.
A new look at the crisis inside Canada's care homes even before the pandemic. And bringing Mother's Day celebrations to mothers in isolation.
Since we can't hug, we have to socially distance. I just hope that this is a ginormous hug today.
We'll be right back.
Banks.
Welcome back. Since the COVID-19 crisis began, we've heard calls for more testing to try to prevent the spread, as well as how hard it's been for some to secure one of those elusive tests. But not everywhere. Jonathan Gatehouse takes us to a drive-through testing center in small-town Ontario.
Sorry about this. Gotta hit the back. 1, 2, 3, 4, and 5. Good job.
It's not pleasant, but for now, this is the reality of COVID-19 testing. A slow, labor-intensive process that often takes days to return results.
Hang in there. 1, 2, 3, 4, and 5. Done. Thank you.
Logan Crawley and Jamie Vu are nursing students who caught the disease while working in a long-term care home.
36.9.
Both tested false negative the first time. They no longer feel sick, but Crawley ended up infecting his father and brother.
It's super unpredictable. Like, I was wearing all the stuff, I was washing my hands, and still somehow I was able to contract the disease.
For months now, experts and politicians have been saying that Canada needs wide-scale mass testing to get a handle on the COVID outbreak and stamp out future flare-ups. But the drive-through facility behind Collingwood's hospital is operating well below capacity, as local demand has flattened along with the curve. And that's a problem, according to Craig Jenne.
Somebody who is disease-free this morning may not be for the ride home. It's contingent on essentially everybody in the community being tested at all times, so that if you know you're disease-free, you want that assurance that nobody you come in contact with during the day has the virus. Otherwise, your test may be meaningless within 24 to 48 hours.
Over the past 2 weeks, the whole country has been averaging fewer than 30,000 tests a day, about half of lab capacity. At that rate, it would take years to test all 37 million Canadians. Is that even possible?
In all likelihood, probably not. But I like to think that if you wanted a test or you warrant a test because you're symptomatic, that you should be able to get a test.
And we're not testing as many people as the raw numbers suggest. Those who contract COVID-19 often get swabbed multiple times. Crawley and Vu have already been tested a total of 8 times. They need 2 negatives in a row to go back to work.
Okay, so they'll be back tomorrow, Erin? Or
Yeah. We'll let you know as soon as we get these ones back.
Okay, take care, guys.
We'll see you tomorrow.
But the news isn't good. They're still positive, which means they'll be back again in a few days. Jonathan Gatehouse, CBC News, Collingwood.
It is time now to answer some of your questions about COVID-19. And joining us this evening, Dr. Michael Curry, an ER doctor at Delta Hospital just outside Vancouver. And Dr. Curry, I know you had a chance to enjoy the fantastic weather we've had here in Metro Vancouver this weekend. And so here's our question. As the weather does start to get nicer, how do we continue to practice safe social distancing while being outside in public places?
Well, Ian, one of the great things about being outside is between the sunlight and the wind, it's probably safer in terms of COVID infection than you are inside. But the same rules apply as has been brought up throughout this pandemic. Make sure to keep a 1 meter distance around all people, so 2 meters between 2 people. Make sure you wash your hands after touching shared surfaces, and also try to stay inside and don't go outside if you have any symptoms that suggest you may have COVID-19.
So as you were out and about today, was it pretty easy to do all those things?
It was. There was a little bit of crowding in our parking lots, but if you just time it, stay inside your car until the people near you have left, it's easy to keep that 2 meter distance. But you do have to think about things a little bit, but definitely try to get outside and exercise, enjoy the weather when you can. Just be safe when you do so.
Next question is about sports. I know you're not a sports administrator, so from a medical perspective, let's go to this question now. Would contact sports have to wait for a vaccine before their seasons resume?
Not necessarily, and it depends on your risk tolerance. So if you're in an area that has a relatively low rate of COVID, what you're acceptable doing is going to be different than in a high-risk area where there's still a lot of COVID transmission. It also varies on the sport. So for instance, in Manitoba, with very low levels of COVID-19, the Gimli Baseball League might be able to resume play. It would be a different story for, say, the Quebec Long-Term Care Workers Basketball League to resume play. So it depends on the risks that we're willing to tolerate and the amount of COVID-19 in the community where the sport's taking place.
Okay, we have maybe 20 seconds, although I do want to ask you about the Gimli Baseball League, but we'll leave that for now. At your hospital, the emergency room in Delta, what are you seeing these days?
We're seeing things returning to normal. Things were very slow several weeks ago, and we think people were avoiding the emergency department. We're getting less seasonal flu, less respiratory tract infections, and our patient visits are coming back to what we would expect at this time of year.
Dr. Curry, always great talking to you. Thanks.
Thank you, Ian.
And of course, if you have any questions on COVID-19, just let us know. You can get us at Instagram at CBC The National or email us covid@cbc.ca. Canada's colleges and universities are bracing for a major financial blow. They rely on revenue from tuition and boarding, but students, particularly foreign students, are reluctant to enroll right now. Deanna Sumanag-Johnson tells us about the impact.
When COVID-19 struck, Fabiana Costa's campus at Seneca College closed and her classes moved online.
I don't think online class will replace what I could learn in person. It's different.
Then the international student from Brazil lost her part-time job. Still, her $7,000 tuition is due, and soon.
If I don't have money to pay, I can't. And what I'm going to do here, I have to go back to Brazil.
The loss of international students is one of the reasons Canada's colleges and universities are bracing for a big financial hit this fall. And new students from abroad may not even be able to physically enter Canada if borders remain closed.
International students contribute about $22 billion a year to Canada's economy. Now, that's not just tuition, that's also rent, that's groceries, that's renting cars or leasing cars.
And it's not just international students who are unhappy with the new normal. This PhD student petitioned Queen's University to waive summer tuition for graduate students.
When we're paying tuition, there's a certain expectation that we're going to have access to the services like our office, our library, student health and wellness.
Bonjour. Universities administrators say they're aware of students' frustrations. At Laurentian University, they've already seen a 10% drop in their summer enrollment and are waiting to see if the trend continues into the fall.
We're looking at all the scenarios that are possible. Those include decreasing the amount of work that we have at the university. We may even have to reduce the total number of courses that we offer.
As the places where young people's futures take shape face an uncertain future of their own. Deanna Sumanag-Johnson, CBC News, Toronto.
Next, a glimpse inside the crisis at Canada's long-term care homes.
This is one of the reasons that so many people got sick and died in long-term care.
Hidden camera video shows a grim reality even before the pandemic. We look at what lessons could be learned when this is over. The Canadian Labour Congress is calling today for national standards around the care for senior citizens in this country. They join a growing list of critics who say the coronavirus has lifted the curtain on a crisis of care for our elders. David Common spoke to some passionate advocates for seniors who say enough is enough, that there is a solution.
COVID is the great revealer. The mass death in long-term care, only a symptom of a sector long neglected. Why did it take a pandemic for us to notice, to care? And will it be enough to force change?
We as a society are failing older people, but it also means that, we're losing parents and grandparents to a system in Canada in an inexcusable state.
Laura Tamblin-Watts runs CanAge, a seniors advocacy organization.
The only good thing I hope that will come out of this pandemic is for us as a country to really understand that the long-term care system in Canada is broken.
Nursing homes are locked up tight now, but 2 years ago, CBC Marketplace went undercover inside long-term care, inside a home that today is struggling with a deadly outbreak.
I don't have 5 minutes. I don't even have 2 minutes.
Yeah.
One.
Never enough staffing in any long term.
No.
Sometimes I look at it as a conveyor belt.
Back then, seeing the impact of short staffing firsthand,
Oh, you have to go to the bathroom?
Yeah.
Okay, I'll let them know, okay?
desperate residents waiting to use the toilet,
Sorry, he needs to use the washroom.
still waiting,
Do you know if there's anyone that could take to the washroom?
staff racing from room to room.
Help me, help me, help me.
Okay, so she can't go. But she's been waiting to use the washroom for like an hour.
By one estimate, Ontario staff were only getting 6 minutes to get each frail resident out of bed, dressed, and down for breakfast.
How can I send it away? Really? We don't want it that way, but that's the way you have to do it.
Minister Elliott, I'm David with CBC.
Such short staffing that we raised the long-standing issue with what was then Ontario's brand new health minister.
How do you address the concerns that these frontline workers have?
We take their concerns very seriously.
Now that same government is planning a review of the entire system.
Many of these issues have been decades in the making, and this sector was neglected for decades.
Back then, healthcare workers were sounding the alarm and demanding not just more staff, but a legal requirement for a minimum staff to resident ratio.
That's a huge, difference, right? But we should do everything for these people, not we just be depressed and sitting in the homes and
This hidden camera captures care workers urging a visiting government inspector to do something out. But she points out the law does not require a ratio, a minimum number of staff to residents, similar to how daycares and schools operate. And so, there's nothing she can do.
yes, they were fighting for that. But in school, we can't tell them how
In long-term care, people are very surprised to find out there is no actual minimum number of sort of staff to residents. And particularly, they're shocked to find out that it may mean that you actually would have, in some cases, one personal support worker to 20 or 30 residents at a time.
In Quebec, staff shortages meant some residents died not of COVID, but of dehydration and starvation, because staff just couldn't get to them. Homes themselves are a problem too. The architecture can hamper infection control. Rooms often shared, bathrooms too, sometimes 4 or more people, separated by little more than a curtain.
This is one of the reasons that so many people got sick and died in long-term care. They simply were not able to be socially distant. Beds are 2 feet apart. You've got communal washrooms. You had communal dining, communal activities. Everything in care homes is communal.
For 20 years, Karen Henderson has warned of the crisis in long-term care. 200,000 beds short nationwide. She says now is the time to build new and build private rooms, so infections are less likely to spread.
So that's where a lot of the money should go. But I also think that there's a tremendous opportunity in retrofitting the older buildings that we have. We have to do better for our long-term care. We've got to do better for our older Canadians, and we're not doing it.
The question for Karen is whether the trauma of the last 2 months will be remembered, whether changes made in emergency will stick.
And my fear, David, is that we have made some changes as a result of COVID-19. There's been some wage increases. There's been some changes in working conditions for PSWs. But I fear that when everything settles down, that we're going to somehow slip back to the way we were unless there is enough of a public outcry to say, we've seen the horrors and we've had enough. And as far as I'm concerned, I never want to end up in a long-term care facility, at least not the way they are now. And I will do everything in my power not to end up in one.
As horrible as the pandemic has been inside long-term care, the legacy of all the death may finally be change. David Common, CBC News, Toronto.
Next on The National, a hard truth uncovered by the pandemic in Singapore. We take a closer look at how the country acted swiftly to stop the spread, but couldn't protect some of its most vulnerable. Every country has its story about the pandemic. We've been looking at how some of them are dealing with this outbreak. France, with more than 175,000 cases, will begin exiting from its lockdown tomorrow. The measures include dividing regions into zones depending on the infection rates. South Korea, widely praised for keeping its caseload to less than 11,000, is now back on the defensive. Seoul's nightclubs were ordered closed yesterday after the highest daily number of cases in a month. Singapore also took an aggressive approach, resulting in just over 23,000 cases and only a few deaths. But in so doing, it exposed some hard truths about its treatment of migrant workers. Terrence McKenna explains.
In mid-January, a tour group from China landed in Singapore and took in all the sights: the harbor, the famous Marina Bay Hotel, and they stopped at the little-known Yong Tai Hang Chinese medicine shop. After they left, the shopkeeper came down with COVID-19. Singapore's first-class public health system swung into action. To start, hospital contact tracers tracked down everyone the shopkeeper had been exposed to, then everyone the Chinese tourists had encountered, then everyone who had shared the same taxis used by infected people. Credit card records and security camera video were accessed. As the contact tracing job grew larger, police were brought in to help, and then the army. The coronavirus outbreak was almost shut down in its infancy. Professor Leo Yi Sin is the executive director of Singapore's National Center for Infectious Diseases.
Well, the other good things about Singapore being very small, it is that it is completely wired up. It is all connected through the latest IT system. So it gives this advantage in terms of contact tracing.
Singapore also moved quickly to mass testing.
We test a lot, and I think because we test a lot, we tend to pick up people that are relatively in the milder phase or early phase of the clinical illness.
But it wasn't enough. In mid-February, COVID-19 found Singapore's weak spot, the so-called guest worker system. 1 million foreign workers, nearly 20% of Singapore's population, are mostly from Bangladesh and India. They slave away for very low wages, sometimes $20 a day. They live in company dormitories, often packed in 10 or 20 to a room. Up to 100 men might share a toilet. Kirsten Han is a Singapore freelance journalist.
If a migrant worker is ill, he's not going to say that he's ill because he's afraid of what happens if he takes sick leave. Because his employer might be unhappy, he might get fined for taking sick leave, he might have his work permit cancelled and be repatriated.
The first migrant worker infection was registered on February 8th. Then the virus showed up at the giant Mustafa shopping complex.
Mustafa supermarket basically cater to a lot of foreign workers. Full range of commodities, they can get anything they want, anything from their own hometown that they need. And that served as one of the amplifier among the foreign workers in Singapore.
In early April, guest workers were confined to their dorms and the economy ground to a halt.
I think with the density of the dormitories and the fact that this isn't the first disease outbreak to happen in dormitories, we've also seen measles and dengue and Zika and things like that. There should have been more attention paid to how vulnerable these communities were to an outbreak. And if you wait for the outbreak to happen before something gets done in an environment where men are living in such close quarters, then you'll always be playing catch up.
The crisis may have brought out the worst in some Singapore residents. Jia Ian Chong teaches political science at the National University of Singapore.
The infection in the migrant worker dorms, I think, is uncovering a lot of the
nastiness, and frankly, racism that have been latent in Singapore society for a long time. People saying, well, these migrant workers, they're dirty by culture, they're dirty, and they have it good here in Singapore. Why are they demanding more? That they sort of deserve their lot. Those kinds of sentiments are coming out in a way that is a lot less varnished than before.
In a TV address to the nation on April 30th, Singapore's Prime Minister Lee Hsien Loong bent over backwards to express his appreciation and concern for the guest workers.
I too send my thanks and good wishes to all migrant workers in Singapore for what you have built and contributed here.
While in Parliament, the Health Minister underlined that it was in everyone's interest to come to the aid of the men in the infected dormitories.
Otherwise, we will continue to be at risk of a spillover from the dormitories into the wider population.
The government quickly built up temporary facilities to quarantine the infected guest workers. The beds kept the men 6 feet apart. Probably because workers are young and healthy, the death rate in Singapore is still very low. Some robots brought them their food and medicine. Other robots allowed them to remotely consult doctors. They seem wild for automation in Singapore, from the robot dog that leads people around in quarantine.
Please practice safe distancing at all times.
To the robot security officer that cautions people to socially distance while they are exercising in the park.
Play your part in fighting COVID-19 with just 2 simple steps.
On March 21st, the government began encouraging all citizens to load a new contact tracing app called Trace Together into their cell phones. The app will keep a log on the phone of every other device that shared close contact with the owner over a 14-day period, information that would be turned over to health authorities if the cell phone carrier became infected. So far, it's not a great success.
Since then, we've learned that a very small number of Singaporeans, about 1.1 million Singaporeans, have downloaded it, which is quite far off from the 3+ million that they actually need before it becomes effective in contact tracing.
Singapore residents may feel that in a crisis, it's okay to share your location information with health authorities, but not with the police and army, who may find other uses for it. There may be limits to technology as a solution to a pandemic. Terence McKenna, CBC News, Toronto.
We'll be right back with tonight's moment.
Honk your horn! Honk your horn!
So Mother's Day did look a little different this year, but the messages for Mom, well, those stayed the same. That's next.
Get CBC Radio, CBC Podcasts, and CBC Music Playlists together for free. Hear it all here. CBC Listen. Download today.
Mother's Day looked a little different this year, but the messages were the same. There were more virtual celebrations, physically distant greetings, and curbside deliveries. For some lucky families, it was a chance to reunite after weeks apart, like 100-year-old Kathleen Murphy, who beat COVID-19.
How are you feeling about seeing your 2 daughters today?
Oh, I really don't know. I'm so happy.
You're so happy. Yeah. You're probably as happy as we are? Yeah.
Hope so.
Others had to get creative and bring a Mother's Day parade right to Mom's front porch.
Look, great! How's that?
And a pandemic sure wasn't going to stop families with loved ones at a Nova Scotia long-term care home from coming together. Northwood is considered the province's epicenter of COVID-19. It remains closed to visitors, but how they celebrated Mother's Day is our moment.
All we keep hearing is the awful news that's happening here, so I just wanted to brighten some days.
She saw us today, was so happy to see us, and she waved and blew us kisses.
She had a chance to talk to each one of her 9 children and some of her grandchildren. And we all wished her happy Mother's Day. She said it was hard. She said, it's good to see you, but it's hard. I said, I love you, Mom, and I miss you. And it's because of this virus. And she said, well, that's understandable. I just hope and pray that this thing soon is over.
Since we can't hug, we have to socially distance. I just hope that this is a ginormous hug today.
Lots of virtual hugs across the country. So to all moms, including my mother in New Brunswick, I hope you had a great day. You certainly deserve it. That is the National for May 10th. Good night.